Hello and welcome to my demonstration of Fujifilm's Amulet Innovality. My name is Jill Vickery. I have a background as a mammographer and I'm an application specialist for Fujifilm. Today I'm going to show you the features of our system and why it will fit and be an asset in your department. When a patient enters the room, customizable lights at the gantry and on the acquisition workstation create a sense of calm. Bringing my patient into this environment, they're able to relax and I can ease their anxiety. This makes positioning easier. When their patient is having the mammogram, their eye is also drawn to the customizable gantry cover. All of these features are included as standard. At the start of the day, I can turn on the machine with the push of one button. It turns on and completes an automatic panel check and calibration in just 8 minutes. This is really fast. Automatic sleep and wake modes are also built into the machine. These protect and extend the life of my detector. With 1 hour of no exposures, the Innovality will enter sleep mode and it wakes up from this in just 45 seconds, so there's no disruption to my workflow. The work list can be easily linked to both screening and symptomatic patients. The workstation allows seamless transition between both of these imaging modes. When I click to open my patient, my views will automatically populate on the screen. When I open my patient, their name, date of birth, age, and ID all appear on the screen at the bottom of the unit. Once I start compressing and positioning my lady, it automatically changes back to my tube angle, newtons, and breast thickness. I can toggle between these two screens at any point, and this is useful for my 3-point check. This is a unique patient safety feature. Fujifilm's unique hexagonal pixels mean that information that's normally lost in square pixel detectors isn't with the Innovality. This means we have greater image quality with lower patient doses. Intelligent AEC built into the Innovality is able to analyze the breast composition, density, and has implant detection features built in. Intelligent AEC is always on, and I don't need to make any changes to my settings. I can easily change between imaging implant patients and non-implant patients. If a patient has any other morphology, or possibly silicon from an old implant which would cause normal AEC to fail, the Intelligent AEC compensates for this. As a mammographer, it means that my images are always optimized. Positioning is made really simple and easy thanks to the one-touch position button. With one click, the machine will automatically move into every position that I need. This has reduced strain for the user. I also can adjust my angle with these buttons here and the ones at a different level. There's automatic left to right angle matching, so if I do change the angle that I use on one side, it will match on the other side. The machine height and compression pedal movement are easily controlled by the foot pedals. These can also be customized based on your department preference. Compression of the breast is optimized by moving at one speed until it reaches more than 10 newtons of compression force. At this point, it will then slowly lower to ease the patient into this. The mammographer will also notice an audible beep when optimum compression has been reached. It makes it more comfortable and less painful for the patient. For me, this is really easy and intuitive because I don't have to lift my foot off the pedal to adjust this speed. The machine slows down automatically once it reaches the patient. When we designed the FitSuite paddle, we had patient comfort in mind. We also wanted to make sure we looked at making things easier for the mammographer. Improving patient comfort means that women are going to attend and re-attend their screening appointments. As you can see, When the paddle compresses, it's actually tilted towards the chest wall. When this comes down, it means that the paddle is able to grab the patient's chest wall and then compress across the rest of the breast tissue towards the nipple edge. This means that all of the breast tissue is adequately compressed. Unlike most adaptive compression techniques, which just flex front to back, the Fit Sweep paddle actually wraps and conforms to the patient's breast shape, meaning it's compressed the way that I, as the mammographer, want it to be. 80% of women who had their mammogram with the Fit Sweep paddle reported a reduction in pain. The Fit Sweep paddle was assessed as part of our NHS BSP approval process. The magnification table was designed with ease for the technologist in mind, which is why it's nice and light and attaches at waist level. It's 1.8 times magnification. Paddle changes on the Innovality can be minimized thanks to the light shift down function. With my button, I can use this to cone down my field, so when I'm using a 24-30 paddle, I can actually have an 18 by 24 exposure field. This makes things a lot quicker and easier for me and is able to speed up my workflow. When I move into my MLO or lateral positions, the light will also automatically shift up to the area for exposure. The Innovality is ergonomically designed to be inviting and supportive. The detector is an ambient temperature, so it's not cold to touch. And soft, rounded arm supports instead of hand grips mean the patient is always supported in every position. An SID of 65 centimeters also gives me all the space that I need when positioning. With over 2,000 systems worldwide, it's important to allow access for patients with reduced mobility and those who may be required to have their mammogram whilst in a wheelchair. Intelligent AEC also assists with this, as I can position the breast anywhere on the detector. Across the mammography market, one of the main questions is wide angle versus narrow angle tomosynthesis. Wide angle is useful in situations where two structures are closely overlying each other, whereas narrow angle can be very useful when microcalcifications appear across multiple slices. The question you should be asking yourself is, why choose just one? The Innovality is the only machine on the market that offers you both, giving your department a level of diversity that no other machine can offer. Technology development in mammography is moving really quickly, which is why we incorporated both modes of tomosynthesis into the design of the Innovality. ST mode, or standard mode, takes just 4 seconds, is a 15-degree sweep, and has dose comparable to 2D. Combination techniques can also be performed, which incorporates a 2D and 3D exposures in one compression. This is better for me as the mammographer, as I only have to position my patient once, and it's better for the patient as this is all done in just one compression really quickly. This improves my workflow and also means that my 2D image can be perfectly compared to my 3D slices. High resolution mode, or HR mode, is a 40-degree sweep that takes just 9 seconds. It has 30% increased dose on conventional 2D imaging, so there's no compromise on image quality. Adding both of these tomosynthesis modes to your department gives you choices and future-proofing that only the Innovality can provide. When I change from 2D to tomosynthesis imaging, I can easily change from my standard face guard to the tomosynthesis one. This can also be used for all of my 2D imaging. The static face guard means that when I'm imaging tomosynthesis, the patient's face can still be supported. Synthetic 2D view, known as S-view on the Innovality, is automatically generated when I finish my tomosynthesis slices. This is generated using iterative reconstruction, and it allows me to easily compare my original 2D image to my new S-view. This is automatically included in any tomosynthesis package. The Innovality's biopsy positioner is easy to use and quick to set up. I can perform my biopsy in stereotactic mode, or I have tomo biopsy for improved accuracy. When I position my patient, I can then take my images to check position. I can then zoom, pan, and window these images to ensure complete accuracy of my target. Once I've selected my target, I can send these coordinates to the biopsy positioner. I have the options of automatic movement or manual movement, or a mixture of both, depending on my choice. Once in position, I can attach the needle. I'm then able to take the biopsy sample. This is a really sturdy system which gives me complete confidence in its accuracy and its targeting ability. If I decide clinically it would be better to use a lateral approach, I can easily change this even mid-procedure. Once I select the change in direction, new coordinates will be sent to my biopsy positioner, and my diagram will also replicate the new direction. The lateral system is easily attached to the machine, and I can also change my angle based on where I would like to enter the patient's breast from. The Innovality is compatible with all commercially available needles. If there are any changes in supplier or more needles to be added, these don't require engineering calibration and can be added by your application specialist or the user themselves. The tube head can also be offset during biopsies to give the consultant and the patient more space. Thank you for joining me for my demonstration of Fujifilm's Amulet Innovality. I hope to see you soon.